This is Dr. James with HelpMommy.com, and I was asked to do a video about lip and tongue ties. And all I can say is just prepare yourself. Let's grab a chair and some popcorn and we'll watch for the comments because this should be interesting. I feel like I'm uniquely qualified to talk about this subject. I have been in practice for over 23 years. I have a large breastfeeding population, probably 80 to 85% of my moms breastfeed. I had a tongue tie and I had it fixed, and I had a complication from it because I don't know if you can see, but there's a little mass underneath my tongue called a mucocil that's developed along where they clip my tongue, and it has recurred over and over throughout the years. I've had it tried to be revised and drained and stuff, and it just continues to come back. So let's talk about what these ties are. So an anterior tongue tie is where this fibrous band comes from the bottom of your mouth and goes up to the tongue and extends all the way to the tip of the tongue. And this can be restrictive and can pull the tongue backwards so that it looks heart-shaped. Now, this could affect both speech and eating. You could see if it was very restrictive and your tongue is stuck to the bottom of your mouth, this is what it would sound like. It would not cause normal speech because you can't get your tongue to the back of your teeth, and this is unacceptable. Also, when it comes to eating, if you can't, your tongue is, the breast is supposed to go into the mouth, and the baby's tongue is supposed to do this on the bottom. If that can't happen because of restriction, then they tend to chomp. This is not an effective way to eat. It's also extremely painful for the moms, and that's unacceptable. So I think in this situation, most of us agree that, hey, that needs to be fixed. Then we have posterior ties, which is just a smaller frenulum toward the base of the tongue, not as restrictive. This is where it starts to get a little controversial. The studies don't really show, it's kind of plus minus whether there's any benefit. A lot of times, even afterwards, when, interviewing moms after this is done, some may see some benefit, some don't. A lot of times you just have, did the baby get better at this? Did the mom get better at this? Was it positive thinking? It's really hard to tell. So jury's on whether that does anything at all. Buccal ties are even more controversial. This is where you have a little flap of skin between the gum and the buccal mucosa, which is the side of the mouth. This is something that you don't see a lot of people doing, but there are still some people that will go and release these ties. Then you have lip ties. This is a little frenulum that goes from the inside of the front lip to between the front teeth. This can sometimes be really thin. It can sometimes be very thick. It can cause a gap between your front teeth. It can also be restrictive and not let the lip move. You'll hear people say that this can be something that it can affect speech. You'll see speech therapists sometimes send people to it. This one's a lot harder to believe because if it was very restrictive and it was holding your front lip to the front of your gums, just kind of take this. If you push down there and talk, you can see that you can still talk very, very normal without a lot of problems. There might be some whistling if you have a large gap in your front teeth, but whether that affects speech, jury's out. If it's very, very restrictive and they can't get their lip to move, you could definitely see where that could affect breastfeeding and cause more chomping. That's actually pretty rare. Usually you'll have pretty good mobility. Things have kind of changed. When I was in medical school and residency, if you had this large gap in between your teeth, what we were told was that a lot of times as toddlers, they would fall and bust it, and that would kind of fix it. We didn't have to worry about it. If that didn't happen around the time they were 4 to 6 years old, to send them to the dentist to get it clipped before their permanent teeth came in. Currently, a lot of the orthodontists are saying, no, don't do that. That causes scar tissue. It makes it harder for them to bring the front teeth together. So they're currently recommending that you clip this frenulum as they put the braces on so that they can bring those teeth together. What I'm telling people currently is that data is always changing. The people are always doing studies to find out whether things work better or not working anymore. I tell people now when I see this that around the time they're 5 years old to go do one of the free consults with the orthodontist and see what the current recommendations are. If they're saying, hey, we need to clip this now, then get it clipped now. If they're saying no, wait, then I would wait. So where do I fall on this? Well, you have a whole spectrum of providers, be it lactation consultants, dentists, pediatricians, ENTs. You have this far side over here that says this is something that shouldn't be done. It should never done. We're not going to do this. This is ridiculous. And I think they probably, are a little too restrictive. I mean, you can definitely see that if you have a very restrictive anterior tongue tie, that could affect speech and that could affect eating. If you have this very thick frenulum in the front teeth, that can definitely affect aesthetics as far as your teeth. And so, at some point that probably is going to want to be taken care of. How that's done and what the current recommendations are, that's kind of in flux and changing. And so, you go with that. On the other side, on the far side, you're like, okay, if you see any little piece of skin there, then go, let's laser it and stuff like that. And I think that's something that you always have to throw up a red flag, because there is passion, there's fatigue, and there's money. Okay. You have a very passionate group of people who want to breastfeed, and I think that's great. But also they're fatigued and they're in pain, which just breastfeeding a lot of times is going to be uncomfortable for the first couple weeks, and they would like to relieve that. And then you have some people, because these procedures aren't necessarily cheap. It can cost $200 to $800 a time. And they could prey on those people. And I think that should throw up red flags, especially when you have something that a lot of times insurance isn't going to pay for and it's going to come out of pocket. I'm more a centralist in the middle. I think every situation is different. You need to assess the baby, look and see what their mouth looks like. Look and see what these ties look like. What is the breastfeeding experience going on with mom? And then put that into an individual situation of, hey, do I recommend this or I don't recommend this? I go both ways. I'll assess the baby. The parents will come in and ask me. I'll assess the baby. And if I don't see any restrictions of the top lip, if I see good mobility of the tongue, I don't see, a huge problem there, then I'm not going to recommend getting it done. On the other side, if I see any of those things, then I am going to do a referral. But I'm going to do a referral to someone who will also say no, that they do this procedure. They're very qualified. They do it well. But they're going to do the same thing as me. They're going to assess the situation. And if, in their expert opinion, they don't think the baby's going to do well with it, they'll tell the parents no. And I want that. And as a parent, you should want that too. You should not want something done to your baby that's not going to help. And too often I see where if you walk through the door, you're going to get that lasered or clipped. And I just have a problem with that. I think that every situation should be assessed. And the problem with the topic like this is there's going to be people that are going to be mad. If you are way, way, way over here, you're going to be mad about anything that's not over here. If you're way, way over here, you're going to be mad that anybody's not there. And if you're in the middle, you're going to be attacked by both of those people. So there's really no way to win. The comments should be interesting on here. But I wanted to just tell you about what it is, what I do, and what my opinions are. Because like I said, I have been a pediatrician for a long time. I have a lot of breastfeeding moms. This is something that I had a tongue tie. I've had it taken care of, and I developed some of those complications that are out there for it. So I hope this helps you and helps you to ask the right questions and find the right people to help you if you need that.